Hi everyone, welcome to Raaonline. This is Dr. Ashok, consultant clinical microbiologist. So today we are going to see an important topic which is important in treating the patients as well as the diagnosis of this particular condition. So it is going to be an bloodborne protozoal infection. So it is caused by a parasite. So let us go to a case and then we will find out the diagnosis, after which we can discuss the theoretical part. So let us go into the topic now. So here is a case study. So here an Indian doctor cleared his USMLE and doing his residency in United States of America. He attends a patient with continuous fever for the past 5 days, and blood sample was sent for peripheral smear examination for MPMF, which denotes malarial parasite and microfilariae, which did not reveal any malarial parasite or filarial pathogen, but reveals the presence of ring form inside the RBC, suggesting Maltese cross form. So he have never seen any case in India before. So here you are getting a clue that it's in the USA, and there's a fever for the past 5 days, and the blood sample was sent for peripheral smear examination for MPMF, so which revealed this particular ring form inside the RBC, suggesting the Maltese cross form. So Maltese cross form is nothing but the RBC where there is going to be 4 rings, so that is going to be the Maltese cross. So we have never seen the case in the India before. So the particular case have not occurred in India before. So this is a clue which you got. So what is the probable diagnosis? So the probable diagnosis is going to be the Babesia. So it is caused by a particular agent called Babesia microti. So it is going to be a protozoal parasitic infection which is going to invade the bloodstream and cause illness which is going to be mimicking the malarial infection. So let us go into the theoretical part now. So this is going to be the Babesia. So the causative agent is going to be the Babesia microti. So it is going to be an protozoal parasite which is going to affect the RBC. So this is going to be the Babesia microti. So here the particular vector which is involved in the transmission of this particular infection is going to be the heart tick. And what are the various clinical features which is going to be pertaining to the Babesia infection? So there is going to be a fever, and the type of fever which is seen in case of Babesia is going to be an irregular fever, and it is associated with the chills and rigor, and there is going to be severe muscle pain which is also called as myalgia, and the patient can have involvement of liver and spleen, so which is going to lead to the enlargement of both liver and spleen, which is also called as hepatomegaly, splenomegaly, or both hepatomegaly and splenomegaly to combine together is going to be the hepatosplenomegaly.